Hello, and welcome back to the Vital Her channel. I'm absolutely thrilled that you've decided to join me today because we're going to tackle a topic that affects millions of American women, but rarely gets the attention it deserves. My name is Dr. Mary Williams, and I'm a board-certified gynecologist who has been dedicated to women's intimate health for over 15 years. Every single day in my practice here in the United States, I see women who are struggling with urinary tract infections during menopause, and frankly, it breaks my heart because so many of them have been suffering unnecessarily for months, sometimes even years. I decided to create this video because just last week alone, I had 7 different patients, 7, come to my office with recurring UTIs that they thought were just bad luck, or something they had to accept as part of getting older. The truth is, urinary tract infections during menopause are incredibly common, but they're also very different from the UTIs you might have experienced in your 20s or 30s. Before we dive into this crucial information that could truly change your quality of life, I want to ask you for a small favor that means the world to me. If this content helps you understand your body better or gives you the confidence to seek the care you deserve, please hit that subscribe button, leave me a comment with your thoughts, and share this video with other women in your life. Your support is what allows me to continue creating content specifically focused on women's intimate health. Today, we're going to explore 2 essential parts. First, the 7 warning signs of UTIs during menopause that are often overlooked or misunderstood. And second, what you can actually do about them, including prevention strategies and treatment options that really work. Let me start with something that might surprise you. Urinary tract infections during menopause don't always present the way they did when you were younger. The classic burning sensation when you urinate? Sometimes it's not even there. The urgent need to run to the bathroom? It might be subtle or attributed to other menopausal changes. This is exactly why so many women miss the early warning signs. Understanding why UTIs change during menopause. Before we dive into the 7 signs, you need to understand what's happening in your body during menopause that makes you more susceptible to UTIs. As estrogen levels decline, the tissues around your urethra and bladder become thinner and less elastic. The pH of your urinary tract changes, making it easier for harmful bacteria to thrive. Additionally, your body produces less of the natural antimicrobial substances that used to protect you. Think of it this way. Estrogen was like your body's natural security system for your urinary tract, and now that security system has been significantly reduced. Sign number 1, subtle burning. That comes and goes. Unlike the intense burning of younger years, menopausal UTI burning can be mild and intermittent. I had a patient, Patricia, a 54-year-old accountant, who described it as just a little uncomfortable feeling that I kept ignoring. She thought it was related to her new bladder sensitivity since menopause began. When we tested her urine, she had a significant bacterial infection that had been brewing for weeks. This subtle burning often occurs at the end of urination or might feel like mild irritation rather than sharp pain. Many women dismiss it as just part of menopause, but it's actually your body's early warning system. Sign number 2, increased urgency that feels different. You might think, but Dr. Williams, I already have urgency from menopause. Here's the key difference. UTI urgency during menopause often feels more intense and is accompanied by a feeling that you can't completely empty your bladder, even right after urinating. Normal menopausal urgency tends to be more predictable and manageable. UTI urgency feels more desperate and is often accompanied by pelvic pressure or discomfort. Sign number 3, cloudy or strong-smelling urine. This sign is often overlooked because many menopausal women experience changes in their urine anyway. However, UTI-related cloudiness is typically more pronounced, and the smell is distinctly different, often described as ammonia-like or unusually strong. I always tell my patients to pay attention to sudden changes in their urine appearance or smell, especially if these changes persist for more than 2 days. Sign number 4, pelvic pressure or discomfort. This is perhaps the most misunderstood sign because pelvic discomfort can have many causes during menopause. UTI-related pelvic pressure typically feels like a constant dull ache in your lower abdomen or pelvis. It's different from menstrual cramps or the occasional pelvic discomfort some women experience with hormonal changes. Margaret, a 58-year-old teacher, came to me complaining of what she called weird pressure down there. She had attributed it to stress and her changing body, When we investigated further, she had a UTI that was beginning to involve her bladder more significantly. Sign number 5, fatigue that seems disproportionate. Here's something many women don't realize. UTIs during menopause can cause significant fatigue even when other symptoms are mild. This happens because your immune system is working harder to fight the infection, and hormonal changes make it more difficult for your body to mount an effective response. If you're experiencing unusual tiredness along with any urinary symptoms, don't dismiss it as just being busy or stressed. Sign number 6, mild fever or feeling generally unwell. You might have a low-grade fever, around 99 to 100 degrees, or just feel off without being able to pinpoint why. During menopause, many women attribute feeling unwell to hormonal changes, but when combined with urinary symptoms, it could indicate a UTI. Sign number 7, changes in urination patterns. This includes urinating more frequently than usual, feeling like you need to urinate but producing very little urine, or experiencing pain or pressure before, during, or after urination. These changes might be subtle at first but tend to progressively worsen if the infection isn't treated. The dangerous mistakes women make. In my practice, I see women making several critical mistakes when it comes to UTIs during menopause. Mistake number 1, attributing all urinary changes to normal menopause. While menopause does cause urinary changes, sudden or progressive worsening of symptoms often indicates an infection. Mistake number 2, trying to treat symptoms with over-the-counter remedies without getting properly diagnosed. While cranberry supplements and increased water intake can be helpful for prevention, they're not sufficient treatment for an active infection. Mistake number 3, waiting too long to seek medical attention. UTIs during menopause can progress more quickly to kidney infections because your immune system isn't as robust as it once was. Why these signs are often missed. Healthcare providers sometimes miss these signs too, especially if they're not familiar with how UTIs present differently during menopause. Many women tell me their previous doctor dismissed their symptoms as just menopause without proper testing. Additionally, the symptoms can be so subtle that they develop gradually, making it easy to adapt to the discomfort without realizing something is wrong. The connection to recurrent UTIs. If you're experiencing these signs repeatedly, you might be dealing with recurrent UTIs, which affect up to 25% of postmenopausal women. This isn't just bad luck. It's a medical condition that requires specific management strategies. Understanding these 7 signs is the first step in taking control of your urinary health during menopause. In our next chapter, we'll discuss exactly what you should do if you recognize these signs and how to prevent future infections. Now that you know what to look for, let's talk about taking action. The good news is that UTIs during menopause are highly treatable, and with the right approach, you can also prevent many future infections. When to seek medical attention. Immediately. First, let's establish when you need to contact a healthcare provider right away. If you experience any of the 7 signs I mentioned, especially if you have more than one symptom, don't wait. Early treatment is crucial during menopause because UTIs can progress more rapidly to serious kidney infections. You should seek immediate medical attention if you have fever above 101 degrees, severe back or side pain, nausea or vomiting, or if you see blood in your urine. These could indicate that the infection has reached your kidneys, which requires urgent treatment. The diagnostic process. What to expect. When you visit your healthcare provider, they should take your symptoms seriously, regardless of how mild they might seem. A proper evaluation includes a detailed discussion of your symptoms, a physical examination, and most importantly, a urine test. There are 2 main types of urine tests: a urinalysis, which can be done in the office and gives immediate results, and a urine culture, which takes 48 to 72 hours, but tells us exactly which bacteria are causing the infection and which antibiotics will work best. I always recommend requesting a urine culture, especially for women in menopause, because the bacteria causing UTIs can be different from those that typically affect younger women, and some bacteria have developed resistance to commonly prescribed antibiotics. Treatment options that actually work. Antibiotic therapy. The mainstay of UTI treatment is antibiotics, but the choice of antibiotic matters significantly during menopause. Some antibiotics that work well for younger women may be less effective for postmenopausal women. Based on the latest research and my clinical experience, I often prescribe nitrofurantoin for uncomplicated UTIs in menopausal women, as it tends to be very effective and has fewer side effects. For more complex infections, we might use trimethoprim sulfamethoxazole or fluoroquinolones, depending on the culture results. Duration of treatment. Another important difference during menopause is that you might need longer courses of antibiotics. While younger women often respond to 3-day treatments, menopausal women frequently need 5 to 7 days of treatment for complete clearance. Hormonal considerations. Here's something many doctors don't discuss. Topical estrogen can be incredibly helpful for preventing recurrent UTIs in postmenopausal women. Applied directly to the vaginal area, it helps restore the natural protective mechanisms of your urinary tract without significant systemic absorption. I had a patient, Linda, a 62-year-old nurse, who was getting UTIs every 2 to 3 months. After starting low-dose topical estrogen along with other preventive measures, she hasn't had a UTI in over 18 months. Prevention strategies that make a real difference. Hydration. Drink at least 8 glasses of water daily. But here's the key. Spread it throughout the day rather than drinking large amounts at once. This helps maintain a steady flow of urine that flushes bacteria from your system. Bathroom habits. Urinate before and after sexual activity and never hold your urine for extended periods. When you do urinate, make sure to empty your bladder completely. Some women find that urinating twice, once normally, then waiting 30 seconds and trying again, helps ensure complete emptying. Hygiene practices. Wipe from front to back always, avoid using feminine hygiene sprays or douches, and wear cotton underwear that allows air circulation. Avoid tight-fitting pants that can trap moisture and bacteria. Cranberry products. While cranberry juice won't cure a UTI, cranberry supplements, specifically those containing proanthocyanidins, can help prevent bacteria from adhering to your urinary tract walls. Look for supplements with at least 36 milligrams of proanthocyanidins. Probiotics. Emerging research suggests that certain probiotics, particularly lactobacillus strains, may help maintain urinary tract health by supporting your body's natural bacterial balance. Common myths I need to address. Myth number 1, drinking lots of cranberry juice will cure my UTI. While cranberry products can be helpful for prevention, they cannot treat an active infection. You need appropriate antibiotic therapy. Myth number 2, if my symptoms improve, I can stop taking antibiotics early. This is dangerous and can lead to antibiotic resistance and recurrent infections. Always complete the full course of antibiotics, even if you feel better. Myth number 3, UTIs during menopause are just something I have to live with. Absolutely not. With proper treatment and prevention strategies, most women can significantly reduce or eliminate recurrent UTIs. Myth number 4, natural remedies are always safer than antibiotics. While I support complementary approaches, untreated UTIs can lead to serious kidney infections. Natural remedies should supplement, not replace, appropriate medical treatment. Creating your long-term management plan. If you're dealing with recurrent UTIs, work with your healthcare provider to develop a comprehensive management plan. This might include low-dose antibiotics taken preventively, postcoital antibiotics if infections are related to sexual activity, topical estrogen therapy, regular follow-up urine cultures, lifestyle modifications tailored to your specific situation, special considerations for women with diabetes. If you have diabetes, you're at higher risk for UTIs during menopause, and infections can affect your blood sugar control. Monitor your glucose levels more closely when you have a UTI, and make sure your healthcare providers coordinate your care. When to consider seeing a specialist. If you're having more than 2 UTIs per year, if your infections don't respond to standard treatment, or if you're experiencing complications, ask for a referral to a urologist or urogynecologist who specializes in women's urinary health. Remember, you deserve to feel comfortable and confident in your body during menopause. UTIs are treatable and preventable with the right approach. I hope today's information has empowered you to take control of your urinary health during menopause. Let's quickly review the key points. UTIs during menopause often present differently than when you were younger, with 7 main warning signs including subtle burning, increased urgency, cloudy urine, pelvic pressure, fatigue, low-grade fever, and changes in urination patterns. Most importantly, these infections are highly treatable with the right antibiotics and preventable with appropriate strategies including proper hydration, good hygiene, and possibly hormonal support. If you found this information valuable, I would be so grateful if you'd subscribe to the Vital Her channel. It truly helps me reach more women who need this information. Please leave a comment below sharing your experiences or questions, because your feedback helps me create content that addresses your real concerns. And please, share this video with other women in your life who might be experiencing these issues. So many women suffer in silence, thinking these problems are just part of getting older, when effective help is available. Thank you for trusting me with your time today. Remember, your health and comfort matter at every stage of life, and you deserve healthcare providers who take your concerns seriously.